Associate Professor Andre, thank you for welcoming us at your house, and we'll be talking today to you about the award that you've just won, the Victorian African Award. Tell us what you feel about that.
I'm very thrilled to win the award, especially given that it is awarded by the community. So this is a way of recognizing the research we are doing and its impact within the community. So I'm very grateful for the award.
And it looks like you've done quite a bit of work in your academic work that relates to the health of African migrants. Tell us a bit more about that.
Yes, my research started in 2002 when I realized we didn't have enough data on African migrants, especially their health. So I embarked on undertaking research, try to understand what happens when they arrive in Australia. And since then, we have published more than 100 papers on the health of African migrants in Australia.
And what can you tell us through the research you've undertaken? What are some of the things that transpire in relation to the general health of migrants?
Yeah, generally there are three major aspects to our research. One, which is to do with blood donation. As you know, Africans usually tend not to give blood, but yet they have a higher needs for blood, especially because, you know, most of them come from an area where malaria was endemic and they've been exposed to malaria. So there's a lot of things that goes on with their blood, so which means they need some unique blood which cannot be provided by the existing blood bank. So my research has been trying actually to highlight the issue related to the needs for African migrants to become blood donors in order to meet their blood needs. So that's one aspect of my research. The other aspect of my research is to do with type 2 diabetes, because African migrants, when they come to Australia, it's like being given a visa to become diabetic. Back home, diabetes is not a big problem, especially in rural areas. But as soon as they arrive here, it's like a visa to become diabetic. So my research has been trying to understand what really could explain that big rise, the increased risks of diabetes or becoming diabetic within 5 years upon arrival in Australia. And one aspect of it, of course, it's the lifestyle change. But recently we've been able to show so that vitamin D deficiency is one of the biggest driver. And so we have been doing a lot of research on vitamin D and vitamin D supplementation as a mitigating factor to prevent the increased risk of type 2 diabetes among African migrants.
And it looks like not many African migrants would even entertain the option of taking vitamin D supplement unless it becomes a problem.
Among professionals, there is a lot of awareness. So that's why we have a lot of refugee health clinics now. Like if you go to Dutagala Community Health Center, you go to the Western Region Community Health Center. So those are specifically established medical clinics to look after refugees and migrants, especially from Africa. And vitamin D deficiency is one of their priority. So yes, there's awareness among professionals, but I think there is limited awareness among the community. So which means that those who are deficient may not necessarily know they are deficient, and it will be very important for them when they go to see their doctors to ask for a vitamin D test. And if they are found deficient, and then take measures to make sure they can correct the deficiency. My other significant research is trying to understand what I call the intergenerational acculturation gap. So what I mean by intergenerational acculturation gap is when parents, especially African migrants, come to Australia, usually parents will tend to remain traditional, hold dearly to the traditional values prior to migration, the values they grow up with, but children want to become Australian. They want to have the Australian identity. And those values do not necessarily, they create conflict. So which means when parents are asking children to live the traditional life, and the children are saying no, to become successful, we need to live Australian life, so that creates a serious conflict. So, and I've been trying to understand how we can address the conflict that is born from that intergenerational acculturation gap. And we've finished a wonderful program with a Spectrum Migrant Resource Center, where actually we educated parents, and the impact was actually very immeasurable. And so we need really to do something about addressing the conflict that is related to the intergenerational acculturation gap.
And if someone would come to you and say, well, you've done a lot of work in this research, what would you tell community leaders out there in terms of the implications that have emanated from your research?
I think what I've done really, and I'm very proud of, is I established the African Review Panel. I'm pretty sure I don't know how much the panel is known within the community. So the African Review Panel is a panel of 12 people who are either elected or nominated by their communities, and their role is to sit to guide my research. And once the fundings are available, they have to take the fundings to their respective communities. And so we have done really well in taking back the fundings to the community, back to the community. However, what is lacking is the community organizational structures to be able to then plan or advocate for programs to address some of the issues being highlighted or the fundings from our research. So that will be beyond what I do as a researcher, but the communities need to be really organized in order to be able to advocate for either programs or themselves plan for programs to address the needs of their own communities. So that's not happening. So I don't know whether community leaders will be the best approach. That's a doubt because of a gatekeeping approach. As you know, our communities, we have a lot of gatekeepers. I think we need more to use the grassroots approach, where actually the communities are empowered to take the issues in their own hand rather than relying on what I call community leaders.
What would you recommend as one of the best ways to raise the level of education and information within the community on important health issues?
I think that where we come in, especially this, because most African watch your program, and I think actually have a role to play in mobilizing the community, because I think although you are getting recognized within the community, and I think if we can even dedicate one section of your program on a health promotion, health awareness programs, and maybe use it as a vehicle to try actually to establish the solid community structures I'm hoping one day we'll have, to be able to take the needs of a community and advocate for programs or implement community-run programs. And I think the AMA has a role to play in this, and I think it will be actually could be a good stepping stone. Because you are independent, you are not necessarily attached to any community, because that's the other challenge, where when you start programs, then you end up with the Eastern versus Central versus Southern, whereas your program is not attached to any community. You are trying to reach out to all African. So I think your neutrality could play a bigger role in trying to raise that level of awareness and actually organize the community to become more responsible for their own destiny as far as health needs are concerned.
Do you also feel like the government or the decision makers, the policy makers, are doing enough in terms of really trying to cultivate sufficient capacity within the community to address these issues?
No, I think the government is doing its best. You have to be aware that depends on which government is in power. So each government will come with a different angle to how they see migration and health, and especially when it comes to African migrants, as you know. But I would say the fact that, for example, I'm funded, my position as a future research fellow is fully funded by the government. So that's a way of recognizing that we need to build that capacity in the community. So I'm an example of a government initiative where I'm fully funded to be able to research and provide the evidence required to inform policy. So there are some other examples of funded position by the government, but what we're lacking in a community is actually the manpower, where people can prop up saying, I'm the next to be actually mentored, to become the next researcher, the next advocate, the next key player within the community. So my role has been actually mentoring a lot of African migrants, and I've taken that very seriously. I've given them scholarships, those who are very good. I've given them PhD scholarships. I've mentored them. If they don't have a degree, I have a few. I've enrolled in doing a Master's of Public Health, and I'll become their supervisor, mentor them. So those are going to be the next leader, the next leaders within our communities. So what we need is more that level of awareness of what's there, what can the government provide to support them to become better advocates, better researchers, better community role models. So yes, maybe they may have those degrees, but they haven't reached the level of understanding of how the government operates. So and that's where my role as an academic comes in, to mentor them. Through your programs, I can tell them what's there for them, or through words of mouth, because some will contact me directly in my office, and I will invite them and I give them some advice and mentor them, and so we are getting there.
And what advice specifically would you give to anyone in the community out there who may be interested in this field, or who just has some sort of leadership role and they think this is important? What would you advise them in terms of some of the actions they may undertake to try to make some sort of progress in this area?
Yes, whether it's health, whether it's social work, whether it's it doesn't need to be health. It can be all area of our lives, of migrants' life. It could be family functioning, it could be social work, it could be health. There are plenty of opportunities there, and I think the community may not be informed of what's there for them. I'll give an example. For example, most universities will have what they call community engagement, where they seek to engage with the community. So the role of community leaders is to find out who is the director or the boss of the community engagement, and engage with them. Most universities will have a community engagement, either program or department or a division, but they may not know who to go to when they want to engage the community. And the community may not know who to go to when they want to engage. I think that's the level of misinformation that exists. So we need, as a community, to start, mobilizing all our sections so that they are aware of what's there for them and how they can tap into those existing opportunities to better the lives of our communities.
Before we finish on this subject, we started with the award program, which was an initiative that we put together to highlight the positive contributions of Africans in Australia. What's your take on how the Africans, whether in Victoria or the rest of Australia, are faring generally?
As far as and that's actually because I've measured, the level of integration. In actual fact, what the media tend to portray is not correct, because when you look at how we're integrating fantastically well. So in actual fact, African migrants, being the most newly arrived migrant communities in Australia, they are integrating fantastically well, despite all the myths created by the media, despite all the myths created by politicians for political gains. We are integrating fantastically well. What we need is more for politicians or any other players to seize on our successes to help us take the next step, rather than trying to ignore the success we've achieved in a slightly very short period. And I believe that when you look at other previous migrants, it took them decades to be able to integrate. We have done that in less than a decade. When you look at the newly arrived migrants from Africa, in actual fact, they are doing fantastically well, despite the myths, again, created by the media, politicians, etc. We're integrating well. And my research is showing that, for example, almost 35 of African migrants are integrating, almost 32% are assimilating, and despite what politicians say we are not we are assimilating, we are integrating, it's only 22% who are remaining traditional. That's a serious success as far as I'm concerned.
And do you think Africans themselves are proactive enough in improving their lot in Australia?
I think African migrants, despite they're not good at selling their successes in Australia. I think that's unfortunate. That's I would say that's a handicap, because we are not very good at selling our successes in Australia. And when we try to sell them, we tend to portray an image of mistrust, because we have seen, for example, so many African awards happening where, for example, it's regionally based, and it's like lobbying a certain region, or where they go to fish people's profile without consent. All those tend to give negative forces, and once the media know that's what's happening, of course they will seize on those small flaws again to portray we as a failure. Whereas if we can sell our success in a more ethical and professional way, we are actually going to command some respect across the board. Unfortunately, we are misunderstood, and what we do, we tend to reinforce the myths, to reinforce those people to continue to misunderstand what we do, rather than actually saying, hey, we are here to demystify everything we put forward and show what we've achieved. So we need really to mobilize our communities to better sell ourselves as a very successful community in Australia.
One last thing is the media there, you say they have, I mean, not every media or organization has been negative about Africans, but there's been quite a lot of publications that have been overly negative about Africans. What do you think is the drive behind the negative portrayal overall about Africans?
To start with, media, they sell well when it's a controversy. So when there's a controversy, they would sell. So it's a mixture of, what I call the need to sell papers, because if you sell a paper that's very controversial, most people want to read it to say, oh, I saw this, I better read it to see what's happening. So unfortunately, that's the pattern that's happening. But what I will need to say, though, is that we haven't been able to create an anti-force that sells our positive story. And there are some avenues. There are some, I've written some positive articles. So some media are prepared to accept those positive stories and publish them. But it's more maybe the manpower within our community to be able to create that cumulative force where we can say, as a community, let's create a cumulative force where our drive is to sell this positive image, and aim at least having a positive image, a positive success at least once a week or once a fortnight, and then we can transform that negative image about our African communities.
Thank you very much, Associate Professor Andre, for your time to Africa Media Australia. We appreciate your time, and again, we congratulate you for your award at the Victorian African Community Award.
Thank you very much, and I look forward to supporting your cause. And I'm very proud to be recognized by the community, and I will do my best to continue to better the lives of our communities. And let me know if I can help in any way to push the cause of AMA. I think the work we're doing is tremendous, and it can only do some goods for our communities.